Hi, I'm Ashley James with Good Morning Maryland. Good morning to all of you who are joining us live this morning. And if you tune in later, good afternoon. Thanks so much for tuning into our WMAR GBMC Facebook Live. We always have amazing topics, and this one I think we can all relate to. Our topic is about sleep. And so this is an interactive discussion on Facebook, and we want you to ask the expert all your questions. We have a doctor in, Dr. Stephanie Wappel, a sleep and pulmonary physician with GBMC Health Partners, Sleep and Pulmonary Medicine. So, Dr. Wappel, thank you so much for joining us this morning.
Thank you very much for having me.
I know this is a topic, I swear, on this shift in particular, we could all talk about it all day because we feel very sleep deprived. But why is sleep so important for everyone?
So sleep is incredibly important. One thing I tell people is that sleep is not an on-off switch for everything in our body. It's just an extension of the rest of our lives, and we hopefully spend about a third of our life doing it. So our immune system, our memory, our emotional memories, tasks that we learn during the day, so our daytime performance the next day, our digestive system, our GI tract, our heart and lungs. Sleep affects every aspect of the body, so it's incredibly important to get enough sleep.
Yeah, you're not kidding. It seems like everything is connected to sleep, and we hear that all the time, but unfortunately it's not always that easy for everyone. Do you have any tips for how to fall asleep and how to stay asleep?
Yeah, so I get that a lot. The one main thing is really consistency. And so our bodies do thrive on routine. I mean, for kids, they typically have a bedtime routine and a sleep schedule, and we tend to lose that as we become adults, although we still need it. So one thing is trying to keep a somewhat consistent bedtime within about an hour range and a consistent rise time that allots enough time for sleep. Waiting to go to bed until you're sleepy, so trying not to force sleep, and doing what you can to find some routines for the half hour before bed that are what I call sleep promoting rather than wake promoting. So avoiding eating, social interactions, particularly screen time, watching TV right before bed, because those things are very wake promoting and will make it difficult to wind down.
I know that's tough for some people. I feel like I'm guilty of it all, watching TV and having my phone in my hand. But if you wake up in the middle of the night, I don't know about some people, but I know that I have had this recently where I wake up and then I just literally can't get back to sleep. And I'm thinking, what, do I just get up at 4 a.m. and start my day on the weekend? Is there a tip for, if you wake up frequently in the middle of the night, does that mean anything?
So if you wake up once or twice in the middle of the night, it might just be normal, although typically you should be able to fall back asleep pretty quickly. So around 3, 4 a.m. is actually when our bodies start to prime us for the day. And so we start to secrete hormones like our cortisol that kind of will get us awake and ready for the day around 5 or 6 a.m. So this is an evolutionary thing that's been around for a very long time. However, that is when you may wake up because for various reasons. And if you do, your body's kind of wound up because you are starting to get ready for the day. So it can be challenging to come down from that. That's where having some kind of relaxing, calming routine that you do right before bed is helpful, because then you can try to go back to that and help yourself calm down. And also recognizing that is kind of normal at that 3 a.m. to wake up. There's nothing wrong. Nothing that you try to solve is going to be solved at 3 a.m. So kind of talking yourself down, honestly, from that can help.
Okay. What is the sweet spot? How much sleep do we really need?
So this has been studied, actually, and for adults, it's typically within 7 to 9 hours. There's some outliers, but for the vast majority of people, it's 7 to 9 hours. So not enough sleep or too much sleep can actually be detrimental to your health, including to your heart.
Wow. So we have nappers out there, and I know that I've always sort of heard the smaller naps are better than the longer ones. But I haven't heard that from an expert, so I'll leave it to you. Are naps okay for adults?
So that's a great question. Naps are okay, but you're right. There's a ideal time of the day and an ideal duration of the nap. And this has also been studied. So ideal time to nap is in the early afternoon, right when we feel that dip in alertness, if you are going to take a nap. Ideal time is really no more than 20, 25 minutes. So we do recommend you actually set an alarm so that you don't oversleep. If you sleep too long, what's going to happen is you'll start to get into your deep sleep, which feels great at the time, but it's really hard to wake up from. And now your body's not restored and refreshed. You're feeling groggy, and it's hard to you don't get that boost.
Gotcha. A lot of people feel very sleepy after lunch. Is that because of after you eat, you just tend to feel sleepy, or is it that time of day that our body says like, oh, you might want to rest?
So it's a little bit of both. If you do have a heavier meal, it can make that dip in alertness a lot more intense. You might feel it a lot more, but we actually have 2 dips in alertness over our 24-hour day, and one of them is in that early afternoon. Our core body temperature actually drops, and we do start to feel a little sleepy. So that's why it is natural to want to lean into that nap, and that's why we feel sleepy. But it should pass. You can overcome it by vigorous activity, exercising at that time of day, or you can lean in and take a brief nap.
I had a really scary moment yesterday in the car, and this hasn't, we work a crazy shift on the morning shift, but usually I'm fine on the way home. But I know that other people have probably been in this situation where, I really felt like, oh my goodness, I feel like I could fall asleep at the wheel. I just felt so tired. And I'm like, am I swerving? Like I started to try to do everything. I'm rolling down the windows. I'm like, come on, wake up, turning the radio up. Is there anything that we can do if we find ourselves in that situation where you're just so tired behind the wheel?
That's a really, really important question, and I'm very glad you brought it up. So I do hear this a lot in sleep clinic, and it can happen to people who are typically getting enough sleep, just if it's, very early morning. So when you start to feel drowsy like that while driving, it can actually be incredibly difficult to overcome that drowsiness. And rolling down the windows, calling someone on the phone, listening to the radio really loud, actually none of that will work, and you may still be at risk of falling asleep. So if you feel drowsy and you have to drive somewhere, don't get behind the wheel if you have the option. If you are driving and you feel it, you have to pull over. That is the best thing you can do for your safety and everyone else's. If you have the opportunity to take a brief nap, that may be restorative, at least briefly. Actually, vigorous physical activity in the short term can help. So even like jumping jacks by the side of the road, if you have to get from point A to point B, but if you can get someone to give you a ride, that is really the safest thing to do.
Yeah. And I think that there's so many people out there, I don't think we listen to our bodies all the time. I'm guilty of it too, but I always remember my parents when I started driving saying, if you get too tired, pull over. And it was crazy that we're having this conversation today, because yesterday I'm like, I think I'm supposed to pull over. Just want to remind everyone to post your questions for Dr. Wappel right now in our chat. She'll answer your questions right now. We have her for about 20 minutes or so. And this is a great time to get all your questions answered. And it's a great topic because, I think, is it true? Like, are Americans incredibly sleep deprived, or is it just people in my world?
Probably the whole world is to some degree. And this pandemic has thrown things really off, but we live in such a 24/7 world, 24/7 culture. There's TV and things to watch 24/7. There's always work to do and emails to check. So, and I think you're right. We kind of don't always respect sleep and the need for sleep. So that seems to be the first thing to go when people are really busy. So probably a lot of people are sleep deprived.
Okay, getting some questions in. What are some natural remedies to help you fall asleep?
So that's great. So that's a great question. We do always emphasize kind of the sleep hygiene, the sleep habits, the behavioral therapies, because that's what's really going to have the long lasting effects once you form those habits. Melatonin can be somewhat helpful for sleep onset. It's a supplement. It's not actually regulated as a drug in the US, so it's the same as getting other herbal supplements. If you take it an hour before bedtime with a consistent bedtime, that's where it can be the most helpful. helpful. There's some other herbal remedies or supplements like chamomile, valerian root. They're not actually, the evidence hasn't shown that they actually help with sleep. They can be calming. One thing is I have had some patients tell me valerian gave them crazy dreams. So just be cautious if you're trying anything new for your sleep that you do it on a weekend or when you don't have to wake up early the next day in case you do not respond well to it.
Yeah, you mentioned the crazy dreams. Dee jumped on and said, is it okay to use melatonin to fall asleep? I've heard that causes nightmares.
So yeah, sometimes it can. Some people have reported crazy dreams or some nightmares with melatonin. It doesn't happen to everyone. If it works, then you're going to have deeper sleep and you may get more REM sleep, or you may not have the tendency to wake up during your REM sleep. So you may remember your dreams and they may seem more intense in that case.
Yeah. Twanda asking, will exercising help? Could you tell me what's so good about exercising when it comes to sleep?
Yeah, so exercise is really important for good sleep quality. It kind of gets your body in a better state to fall asleep, and it kind of uses your energy during the day and boosts your mood so that you feel more at peace going to bed. The one risk with exercise is it's very wake promoting. So if we had our choice, the ideal time to exercise is around 10 a.m. in the morning, but that doesn't work for a lot of people. If you exercise within 3 hours of bedtime, it actually will make it much more difficult to fall asleep. So while exercise is really important for sleep quality, timing is key with a lot of sleep recommendations.
All right, Kim, we'll get to your question in just a second. Next, Mary saying she had a sleep apnea diagnosis, but is afraid to try the machine. She uses melatonin each night. So sleep apnea, I'm sure is a whole other topic, but for those, is the CPAP or the machine I'm sure she's talking about, I mean, is that really common?
So obstructive sleep apnea is a very common sleep disorder. It's one of the two most common sleep disorders in addition to insomnia. One of the most effective treatments overall is a CPAP machine. So what happens with obstructive sleep apnea is that your upper airway, the nose to the vocal cords, is collapsing and closing while you're sleeping. So you can't get enough air, you can't get any air in. How the CPAP works is that it is delivering continuous positive airway pressure through a mask, and that's keeping your upper airway open. It's not the only treatment for obstructive sleep apnea, but it's very effective, and there's a lot of different masks out there. There's different settings we can adjust to make it more comfortable, but you can also see a sleep doctor and talk about more options depending on how severe the sleep apnea is.
Kim said, do you have advice for night shift workers? And to just piggyback off of that, I know on the shift many of us work, whether it's this early morning shift or open, we're always told we need the sleep, but I mean, it's also not always realistic, right? To go to bed. I can't go to bed before 7 o'clock because, with the kids and all this stuff. So what is how do you make that work in life?
So a lot of people do have night shift work sleep disorder, but a lot of people actually adjust very well. So one of the greatest external stimulus for wakefulness is sunlight. And it's particularly the blue light, but the best source of it is the sunlight. So if you are working a night shift, anything you can do to increase your sunlight exposure, like before you go into work, can be helpful. Some people actually even use a light box. But more importantly, when you're coming home from your shift, if you can make sure you wear sunglasses on the ride home, make sure that your home environment is dark, especially your sleep environment, use blackout curtains. Some people do find that melatonin is useful in the mornings when they're getting off their shift, again, to kind of switch their circadian rhythm. Other things that are very wake promoting are exercise. So if you have this tendency to want to come home from your night shift and then exercise before going to bed, it's going to make it really challenging to fall asleep. If you're eating right before when you come home, that's going to make it challenging too. So if you're able to eat a few hours before your shift's over so that you come home, you've already digested and you're kind of ready for sleep. And so really doing what you can to get 7 to 8 hours of continuous sleep in a dark, cool, comfortable, quiet sleep environment. A lot easier said than done, but the sunglasses are really helpful in the mornings.
Is it cheating to do like 4 hours in one? You get home and you do 4 hours and then you do 4 hours later. I know some people on our shift sort of have that sleeping pattern. Is that cheating, or do you need it all in a row?
So there's no morality in sleep. So I wouldn't call it cheating anyways. I think ideally those 7 to 8 hours are continuous, but life is life. And if it is not causing a problem for the person, then keep doing what you're doing. So if you feel you're getting enough sleep, you're not sleepy during your shift, you're able to stay asleep when you do those 4 hours, you have to also incorporate your sleep schedule into your life. So I wouldn't call it cheating if it works for the person.
Okay. Dee writes in, my husband snores and the only way I can sleep is with the TV on to drown out his loud snoring, but then I don't get good sleep. What are your suggestions?
That's a really tough situation. So if your husband snores a lot and is having pauses in his breathing, then you may want to ask if he would get it checked out and speak to his primary care doctor in case he has sleep apnea. Sleep apnea can sound really concerning for the bed partner and can definitely disrupt their sleep. So for you, the TV, it can drown it out, but the problem with the TV is that blue light. It's very similar wavelength to the sunlight, and it just tricks our brain into thinking that it's daytime. It's going to inhibit or suppress your melatonin secretion, which makes it harder to fall asleep, and it keeps your brain wired. So if you're able to use some kind of app on your phone that has like a bedtime story, Insight Timer has some of those, or even guided imagery or calming music, or something that kind of you do have noise in the background, or a white noise machine, but you don't have that blue light from the TV.
Deborah said, is Ambien bad to take every night?
So that's a great question. Again, no morality in sleep, so it's not good or bad. So we do often recommend that people are taking a prescription sleeping medication on an as needed basis if it's something like Ambien. That being said, some people with severe insomnia have what we call a low arousal threshold, where they're just really likely to wake up throughout the night, and some of it is genetic and we can't fully reverse it. So primary therapy for insomnia is behavioral therapy, and really focusing on strategies to help you fall asleep and stay asleep that'll be long lasting. So if you're using Ambien every night and haven't talked to your primary care or a sleep doctor about any behavioral strategies you can try, then I would recommend that.
You hear a lot of people say, I have insomnia, but what really defines insomnia?
Another great question. So usually we're talking about chronic insomnia, which is something that's been going on for at least 3 months and has to occur at least 3 nights a week. It is characterized by a kind of persistent difficulty in falling asleep or staying asleep, or not getting enough hours of sleep because you have an early morning awakening and you can't fall back asleep. To be a disorder, it has to cause daytime impairment, meaning daytime sleepiness, irritability, depression or anxiety, decreased work productivity. So those kind of things those symptoms have to be present for it to be a disorder.
Mm-hmm. We had a question written in. You hear some people say, I don't need any sleep. Do some people just function better, on 4 or 5 hours? And is that okay? Is that healthy for them?
So I hear that sometimes from some of my patients, particularly people who kind of chronically work double shifts. The evidence does not support that theory. For the most part, there are some extreme outliers who genetically have short sleeper gene. It's very rare. It runs in families. So everyone in your family would have to have it, and you can function on about 6 hours of sleep with no impairment. Most people need 7 to 9, ideally, 7 to 8 is probably more realistic hours of sleep. And so overall, the data does not show that you perform as well, or that you're not at risk of drowsy driving if you're operating on 5 hours of sleep chronically.
Mary wrote in, how does blue light on a computer, phone, TV, how does that affect your sleep? I know you mentioned this a little earlier, but it sounds like it affects it a lot.
Yeah, no, it does. And so the biggest thing is that, again, your primary external stimulus for wakefulness is the sunlight, and that is primarily blue wavelength. So what happens is the blue light, it's the same blue light on our TV screens, especially, and this laptops and phones. So that hits the eye, and particularly the retina, and it sends a signal to the brain saying, hey, it's daytime, stay awake. And so how does our brain stay awake? It says no melatonin. So it suppresses or inhibits the secretion of melatonin. Melatonin is our sleep hormone. It primes our body for sleep and helps us fall asleep and stay asleep. So if you're watching TV and have that blue light stimulus throughout the night, or at least right before you go to sleep, it's tricking the brain and sending mixed messages.
I think you mentioned this earlier, but how much of a window should you give your time between not watching TV or not looking at your phone before going to bed?
So ideally, I'd say as long as you can, but I think realistically, at least 30 minutes to kind of give yourself a washout and tell your brain that, it's nighttime, start to wind down.
Gotcha. Is there anything that we can do to prepare ourselves for daylight saving time?
So this transition is actually the more natural transition. The daylight saving in this spring is what is really, really concerning for people's health, risk of accidents, risk of actually cardiovascular events like heart attacks. So we're coming into the natural transition where it is lighter earlier in the morning and it starts to get darker earlier in the evening, which helps retrain our circadian rhythm. The people of the most difficult time adjusting to this switch are actually who we call the larks, the ones who do go to bed early and get up early, because now their 5 a.m. rise time is 4 a.m. And even if they have to shift their bedtime an hour later, they're still going to want to wake up early. It usually takes about a week to fully adjust to the time change. And so you can try to shift your bedtime 10 to 15 minutes and your rise time. That's challenging with your continuing work schedule is the same. So
I got it. So when should somebody see a doctor? I mean, what are the signs that people should be aware of, the issues that they might be happening? And, what's the first step in saying, okay, I need to see a doctor?
So excessive daytime sleepiness is a very concerning symptom where people are falling asleep at kind of inappropriate times or while driving, certainly, or in work meetings when they should be engaged. Or if people are having a lot of difficulty falling asleep at night, feel like they're only getting 4 hours of sleep and are very irritable, start to develop depression or anxiety around that. If a bed partner reports loud snoring where it sounds like someone's having pauses in their breathing, that's a sign for concern. And also if they were having any abnormal behaviors during sleep, like frequent sleepwalking or kind of acting out dreams or having intense nightmares, those are also reasons to see a sleep doctor.
And do you go right to seeing a sleep doctor, or do you have to be referred by your primary care?
So you can go, you may go directly to a sleep doctor. Primary care doctors are excellent at addressing sleep issues, especially as a good starting point. They certainly overall recognize the need to refer if needed, but a lot of primary care doctors or providers are managing insomnia for their patients, as well as obstructive sleep apnea to some degree. So start with your primary care.
Yeah. And for those who might be a little nervous to come in and see a sleep doctor, could you take us through just a typical first appointment?
Sure. So I like to be very thorough because, again, sleep is an extension of your life. So I usually ask a lot of questions, as do my partners. We just try to get a sense of when the sleep problems started, when they when their symptoms started, what kind of symptoms are they having, what other conditions like sleep-related reflux or heartburn are they having, and then, what other conditions do they have, like hypertension or high blood pressure that may be associated with sleep apnea, say. And then once we go through everything, we talk about our options for diagnostic testing, like a sleep study, and then maybe behavioral therapies. So first appointment, you're not getting any needles or you're not getting any testing. We just go through everything and do a full assessment.
Gotcha. Okay. So the first appointment, you're not necessarily going to need to go sleep over or do anything.
Right.
Really chatting with the doctor and getting to know them.
Exactly.
Perfect. What is probably the most common question or concern you get from your patients?
So I most often see people with obstructive sleep apnea as well as insomnia, but honestly, a lot of that insomnia seems to be related to obstructive sleep apnea. So one of the biggest concerns for my patients is the daytime sleepiness and not feeling refreshed. So that's a major question they ask is, why did this happen to me and what can I do about it?
Gotcha. Well, we've had so many questions that came in, and I know that people will probably have more. If they want to get in touch with you and they're interested in seeing a sleep doctor, what's the best way to get in touch?
Sure. So our office phone number is 443-849-3901. So someone can call our office and make an appointment with me or one of my partners, Dr. Webe or Dr. Moon. We're all happy to see you. We are doing a lot of video visits right now. We do have some in-office time as well, but we're doing a lot of video visits to do the initial assessment, and then we can determine what we need to do from there to help your sleep.
Yeah, and it sounds like after our conversation that it's really not something you want to mess around with, because sleep is just tied to everything in our lives, it sounds like.
It is. And when I see people come to me who are quite young, I really commend them. I mean, I certainly commend my older patients too for getting it addressed. But when people come to see me in their 20s and 30s, I'm like, this is so important to address your obstructive sleep apnea now so that we can really prevent complications down the road.
Great. Well, thank you so much for your time. This was a great conversation. I really appreciate you being here with us. GBMC is so good at replying to people on Facebook if you had another question for Dr. Wappel. But Dr. Stephanie Wappel, Sleep and Pulmonary Physician at GBMC Health Partners, thank you so much. We appreciate your time. And thank you all so much for joining us. We will see you back here next month for our Facebook Live.